Hello my dear subscriber and viewers, welcome back to Akshara Akshita 2023 channel. In this video I am going to explain about radiological chapter. So CPT radiological chapter. This video is part 1. So those who are not subscribed my channel, please subscribe my channel, press the bell button, select all, then only you will get my future videos as a notifications. Okay, so in this end of the video I am going to share this radiological related anatomy physiology definitions, anatomical physiological prefix suffix, also supine, what is the meaning of supine positions, oblique positions, these related terms meaning I'm going to share in the end of the video. Please don't forget to watch until the end. Okay, in this first point I'm going to share in this video type of the radiological services. What are the types of the radiological services are available in this chapter? The first one is diagnostic radiology, that is diagnostic imaging, code range from 70010 to 76499. Next is diagnostic ultrasound 76506 to 76999. Radiological guidance 77001 to 77002. Breast mammography procedures 77046 to 77067. Next is bone joint studies 77071 77086. Radiological oncology 77261 77799. The nuclear medicine code range from 78012 to 7 tetra 9. So in this chapter, in this video I am going to explain about only first point, radiological diagnostic radiology. So it covers CT, X-ray, MRI, and what are the terms we are using in radiological chapters. Okay, so what is the radiological report, how the radiological report will be? So radiologist written report is documentation for professional component of the radiological procedure. So it must be signed also. So report should be there and sign also should be there. If sign missing, we should pen that report, pen that claim, and if it is radiology documentation is incomplete, we should not code. So both should be completely available, then only we can code the radiological report. So report should be documented by radiologist and signed by them. Okay. Next let's see diagnostic radiology. What is the diagnostic? To identify what is the problem of that patient, what is the condition of the patient. To identify that, doctor may use radiological services. So there are few radiological services available in our CPT book: X-ray, MRI, CT, CTA, MRA. So based on this, we need to code the final CPT code. The first step is we have to determine what is the location of this service. Either it is knee, abdomen, or where doctor is doing this diagnostic study. So the first point is location. The next point is what type of doctor radiology service doing. Either it is X-ray or MRI or CT scan. Okay. So X-ray, what is the meaning of X-ray? X-ray is like taking a picture or snapshot of the inside of the body. This is the X-ray, that is plain X-ray. Okay. CT scan uses services X-ray to produce the cross-sectional picture of the body. MRI produce slices of the images by using any magnetic field or proton within your body. This is MRI. The slice can be combined to produce 3D images that may be viewed from different angles. So this will comes under MRI. So MRA or magnetic resonance angiography is an MRI of the blood vessels. Okay, when coding of diagnostic radiology, the coder will need to determine first anatomical location, then type of the radiological used, either X-ray, CT, MRI, etc. Then if it is X-ray means, then we need to look for the number of the views. The type of the type of the views taken. Next is if it is CT means with contracts or without contracts. First let's see views related points. Okay, so in views, doctor first we need to identify the site. So in this example 73560 radiological examination, that is plain x-ray. So what is the site? Knee. So after that for knee there are three CPT codes. So these three CPT codes is based on the number of the views. So next point we have to check on our questions how many views doctor has taken by using the x-ray. Either 1 or 2, 3, 4, etc. So based on the number of the views we have the code. For example, for knee 73560 is for 1 or 2 views, and 73562 is for 3 views. 73564 is completely 4 or more views. Okay, sometimes code descriptions will state minimum number of views. So when this terminology is used, the code will include any number of views in excess of the number of provided in the description. Okay, so minimum number means no need to count the how many numbers doctor is doing. So the terms, if doctor is the term is there in our CPT descriptions, minimum number of views means, so it is including any number of views. Okay, next, for example, description of CPT code 73610 is radiological examination ankle complete minimum of 3 views. So whether 3, 4 more views are taken, so we have to code 73610 only. If they have mentioned in our CPT description itself minimum of some number of views means, so we can consider from 3 views to n number of views. Either it is 3 or 4 or more on this. So like that, if description is there, we have to look for the only minimum, then maximum number no need to count it. So how many we have, apart from 3 we have to code only this code. Okay, so next is administration of contracts material. Okay, contracts materials sometimes we may use in our CPT description with contracts, without contracts, or without contracts followed by with contracts. So what is the meaning of contracts? The contracts, it is a material or it is a one substance, so that lights up the structure of the our body. So it is used to study that structure, it can be visualized. So this substance is called as contrast. So these contrast materials, they may administer by three ways. One is intravascularly. What is the meaning of intravascularly? So it is using any vein or artery is called as intravascularly. So if the contracts is administration via joint means intra-articularly. So within sheath or within subarachnoid or cerebral fluid, if doctor is administrating the contracts means that is called as intrathecally. So with these 3 ways, doctor may administer that contracts materials. Okay, so according to our CPT guidelines, if it is doctor is administration done by oral or rectal means, we should not code the with contracts. This type of the contracts administration is included in the CPT code itself. If doctor is administration is done by these 3 ways, intravascularly, intra-articularly, intrathecally means we can code as with contracts or without contracts, whatever it is. But if doctor is administration is done by oral or rectal means, we should not consider it is as a with contracts. Okay, this is the main point. Okay, then so for example, sometime we have to remember that in CT, MRI, in our CPT description, we have without contracts followed by with contracts. Let's see one example. So, some studies such as MRI, CT scan may be performed without contracts followed by with contracts. So, for example, the code is 74170. 74170 for studies without contracts followed by with contracts. So sometimes like that, if there we have to give only combination code. So with contract separately, without contract separately, that code we should not use. Only combination code we have to use, like without contracts followed by with contracts. Okay. So when you are coding imaging guidance, you may need to code additional procedure also. So we have to watch carefully parenthetical instruction following imaging codes. So to see if the another procedure such as injection or some other procedures for contracts should be reported or not. So we have to check thoroughly from the parenthetical instruction following the any imaging codes. Okay, the contracts materials is not included in the radiological procedures, so and can be reported separately. So typically with the HIPICS level 2 code to identify the substance used. So contracts materials is reported by the facility unless this procedure performed in physician office or physician's own equipment, unless until we can report this radiology contracts material codes by the facility department. Okay, so that's all about the contracts materials. So these are the guidelines, these are the terms we have to know when we are giving the diagnostic radiology. If X-ray means how many views, if CT, MRI means with the contracts or without contracts. And one more important topic is S and I. S and I means supervision and interpretations. So supervision interpretation describes the code description itself. We may get supervision and interpretation of the radiological procedure. So common procedures contains an SNI component include vascular procedures or any veins artery related procedures. We may see this SNI descriptions. Code description itself we get SNI, that means supervision and interpretations. When a procedure records this radiological guidance, a code for surgery or medicine sections, we may use this interpretation and supervision and interpretation. Okay, so if the same physician provider performed both surgical section as well as radiological guidance, then physician will report both code. Okay, when physician performs only surgery and radiologist performs S and I, so each will report the code for his or her portion of the services. If surgery doctors surgery is done by surgery doctor means only surgery code we have to bill for to the surgery doctor. If radiologist performed S and I supervision interpretation part means, so this service we have to bill to the radiologist doctor only. If any physicians, any surgery physician performed radiologist on that supervision interpretation part as well as surgery means, then we can bill 7 series code and surgery codes to the particular same doctor. Okay, so this is the meaning of the supervision and interpretation, that is S and I. Okay guys, that's it about from this part. Let's see next part, ultrasound, mammography, or whatever the next content will be. So we'll look for the next video. So now I'm going to share you some important terms of the medical terms and anatomical physiology from the radiological sections. So I hope this notes will be very useful who are preparing for CPC exams. Okay guys, if you like this video, please like and encourage my channel to come up. And if you like or if you have any doubt, please comment. Then those who are not subscribed my channel, please subscribe my channel. Let's see next video guys. Thank you for watching my video. Thank you so much. Bye bye.